It is now just shortly after 8 p.m. on Wednesday, November 19th, 2025. Today has been a very busy day. And in spite of the multiple requests from Dad's surgeons and from his surgical team, specifically the main doctor who has been working on his abdominal surgery for months now, the insurance denied Dad's claims for extended nursing care at a nursing facility that would be professionally equipped and way more proficient at helping Dad with his post surgical complications than I would be able to perform for him or assist him with here. I am not a nurse. I am not a doctor. I am a mental health professional, but not a doctor. And therefore, my father's medical complications, including excessive bleeding, sutures, things like that, are way out of my league right now to take care of. But he's coming back because the insurance has denied his claim and for no medically valid reason and no reason that makes any sense at all except for their own bottom line and saving some bucks in terms of dollars. So what I've been doing is cleaning and organizing and dusting. And I just wiped down this entire couch with a clean washcloth and wipe down all the cushions. I mean, there's no easy way to wash cushions, especially if they're decorative, embossed, embroidered couch cushions. You can't just toss those in the washer. You need to just take a clean washcloth with a little bit of rubbing alcohol and wipe it down, just disinfect it. My point is, anytime that you discharge a medical patient from a hospital that is not ready to be discharged, and that is having some ongoing complications and serious bleeding problems, and you deny their claims for extended care because you're just trying to save a few bucks, well, what happens is that that patient ends up back in the emergency room within a short amount of time because of their ongoing medical problems, right? I mean, if you have an ongoing medical problem, it's better to take care of it when it is happening rather than wait for it to linger and to become worse. And then the patient has to go back to the emergency room. And this costs the insurance actually way more money in costs. I mean, an emergency room visit is thousands of dollars rather than the insurance would have initially paid out for a extended care nursing facility that is maybe a few $100s per day, but certainly not in the thousands of dollars. Often what happens when post-surgical patients are discharged home before they are ready and then have to go back to the emergency room is that they end up back in the hospital as inpatients because of their post-surgical complications that were not initially taken care of by providing them with extended nursing care at a approved nursing facility. And then the insurance has to shell out tens of thousands of dollars more than they would have shelled out had the patient's initial insurance claim been approved for extended nursing care. So I'm cleaning, vacuuming, just vacuum this entire space. I still have to do the upstairs. I want to make sure Dad's environment is completely clean. I've wiped down all the surfaces. And hopefully he will not end up in the emergency room within a few days. But, saving a few bucks is way more expensive than actually putting up front some costs that would ensure no repeat offenses in terms of patient medical issues. So repeat offenses end up back in the hospital, right? So because they haven't been addressed initially, and it costs the insurance so much more money down the road. My dad's not ready to be discharged. He is having bleeding. He is having severe pain, dizziness. He's over 80 years old. He can barely walk. He's fragile. And the stupid insurance has denied his claim for extended nursing care at an approved 5-star nursing facility that he was already accepted at just because they're trying to save a few dollars. And ultimately, this is going to cost them tens of thousands of dollars because if he is not medically ready for discharge, he is going to end up having to go back into the emergency room as a repeat offender, not because he did anything wrong, but because the medical team were not able to initially continue to take care of him as needed. And then he's going to probably end up back as an inpatient with complications that are going to cost the insurance tens of thousands of dollars more than they initially would have had to pay had he been approved for a nursing facility that's just a few $100s a day. So again, trying to save a few bucks by cutting corners never works. I really do hope for his sake he does not end up back in the emergency room in a few days. But right now with these bleeding issues, dizziness, pain, which I am not equipped to deal with. Again, I can vacuum and clean. I cannot take care of a post-surgical patient that is having bleeding issues and wound complications and things like that, then you know what? That insurance is just going to be bitten in the ass by their idiotic decision to cut costs for no medically valid reason. Too bad for them.